There are two areas that I believe Congress can come together in a bipartisan manner to improve our healthcare policy in this country. One is to stabilize competition in the insurance marketplace, which we don't have today, particularly in the individual marketplace. And there's several proposals that are out there, including that the cost-sharing payments be guaranteed so insurance companies don't know whether these cost-sharing payments are going to be made or not. There are markets that are not terribly stable that need a reinsurance program. We can put reinsurance in that can help stabilize the insurance marketplace. And there are other ways we could get more competition with certain select markets using some form of a public option if there's not enough competition in those areas. So there are different ways we can stabilize the insurance marketplace so you don't get these 25 and 50% premium increases, which are just unconscionably high in a given year. The second area where we can come together is a more cost-effective delivery system. And you really tie into that because what you're saying is that you're going to reduce hospital stays by 5 days, 6 days, 7 days. That's big savings. Maryland, Jim, you may not be aware of this, but Maryland has a unique, only all-payer Medicare waiver system in the country on hospital care. It's now a pilot program. It's been going on now for about 30 years. But what we get rewarded for is bringing down the per capita hospital cost in our state. We already brought down the per episode hospital cost. We've done that. The problem is we have too much utilization of hospitals because people are there that shouldn't be there, readmissions, because you have older people who don't follow their advice. You have home circumstances that are not safe and people fall, things like that that are causing a lot of readmissions. So we are working, and I was out at one of our rural hospitals that have an incredible program on visiting nurses that really do bring down the overall cost, and they can get reimbursed under our system because they're bringing down the overall utilization rates in the hospitals, and they've demonstrated that. You're the same way. You can demonstrate that your system, by this type of technology, that you're going to bring down the overall number of days necessary to stay in a hospital, which is the big cost centers of our care. We're also looking at ways of using telemedicine. We're looking at ways of using integrated care models, particularly on the drug addiction issues, that we have treatment available in emergency rooms and in primary care settings. We have a great program here between Shepherd Pratt and Mosaic doing some really good things on integrated care models that bring down costs. I say that because I do think we've already seen the Democrats and Republicans come together on this in the CURE Act and others to look at ways to bring down overall cost of health care. Well, when you're looking at pharmaceuticals or you're looking at technology here, tie into that, because rather than being defensive and trying to protect a reimbursement structure, be on the affirmative, saying, look, let's reward where we have drug therapies that are bringing down costs. Why shouldn't we be rewarded for that rather than you're trying to penalize us? I think that's an area where you can bring Democrats and Republicans together.